Continuing the obsessive compulsive disorder and sexual dysfunctions, the contamination issue and contamination facts related to driving us away and isolating us from dealing with daily activity could cause, in return, fear of relationship and expressing our basic feelings, which basically sexual feelings are a very disinhibited basic feelings that could be expressed and could be restricted depending on our controlling our feelings related to becoming obsessive about life and restricting ourselves, which then again is going to be dampened and not be able to express. Now, a lot of sexual dysfunctions and problems related with sexual dysfunctions, which secondarily is manifested by intensification of obsessive compulsive disorder, would be able to be taken care of and cared for and treated by behavioral modification techniques, which I go into that and talk about that a little bit more, and biological aspects of using medication. Basically, as I was discussing, the fear of contamination is not that we are going to be contaminated by germs, because germs are all over the place and everybody could get contaminated, and people at a very old age with immune systems that are not strong enough as a 20-year-old man or woman are not susceptible to those germs that a person who's suffering from obsessive compulsive disorder is going to avoid his or her behavior in order not to get contaminated. And therefore the contamination thought is very potent, not the real germ that is going to be contaminated. And therefore the fear of and the need for cleaning, to check and to clean and to check and to recheck, is not just that we are running away from the germs per se to be contaminated, but the person who's suffering from obsessive compulsive disorder is trying to avoid the thought, the fear, the thought of contamination with a germ, which is even worse. And therefore, the behavioral modification techniques for this kind of treatment is both with psychological and biological aspect of the treatment of the problem. The biological aspect is basically based on some theory about serotonin dysregulation in the brain system, which is serotonin is a messenger between the cells in the brain system. If we can imagine a building that we have messengers taking mail and going and distributing to different departments of that building, the serotonin is that role in the system, in the brain system. And therefore, changes in the serotonin balance, the theory goes, could cause a lot of manifestations of obsessive compulsive disorder, generalized anxiety, social phobia, and major depressive disorders. And therefore, with trial of medication to inhibit the serotonin reuptake in the brain, means like, you know, the metabolism of this substance serotonin, to inhibit that and then to regulate, upregulate, to bring it up in the brain system so that the messengers would work their job and then to get the message throughout the brain system, then it's been seen that it's going to decrease the obsessive compulsive ritualistic behavior and the thought, the obsessive thought of fear of contamination.